I'll be demonstrating how to give an IV push medication into a central line. I've checked the MAR and I see that I have an order for Lasix 20 milligrams now IV push. So I need to look it up in my drug reference book, and I see that it's furosemide, same thing as furosemide, and I've pulled my medication vial. It's a diuretic, and under dilution it says it may be given undiluted. Therefore I am going to give it undiluted. Unless it has to be diluted, we want to not dilute it because that's an extra manipulation of the medication and syringes, and increases the chance of contamination. Anytime you're working with IVs, particularly central lines, you have to use strict aseptic technique to prevent a bloodstream infection. So I won't be diluting that. And I need to check the rate of administration, and it says for every 40 milligrams or fraction thereof, it should be given over 1 to 2 minutes. I'm giving 20 milligrams, which is a fraction of 40, so I will give this over 1 to 2 minutes, and I'm going to choose 1 minute. So, wash my hands. And when you use hand gel, you need to make sure that your hands dry completely for full antiseptic effect. Don't wave them around or blow on them. Just let them dry. Rub them together and let them dry. Okay, so I have my medication. Vials generally have a plastic cap on the top that snaps off. This is just a dust cover. It doesn't keep the top sterile, so I'm still going to need to clean that with alcohol. But first I'm going to get my syringe ready. The amount that I'm giving, it says there's 20 milligrams in 1 ml, so I'm going to use a 3 ml syringe so that I can draw it up more accurately. I can read the dose more accurately. And I want to scrub my hub for 15 seconds using my watch, or scrub the diaphragm of the vial, I should say. Make sure and use your watch to make sure that your timing is accurate. Okay. And then I need to wait for that diaphragm to dry, a minimum of 10 seconds and longer if necessary. Again, I'm going to use my watch so that I time it accurately. And you want to make sure you drop all the medication. The needle will go into the sharps, and I want to carefully make sure that I get all of the air out of the syringe so I don't cause an air embolism, and I want to be careful that I don't lose any medication. I need 1 ml in here. And I want to label it right away so I know what medication is there. So, Lasix 20 milligrams. When I label my syringe, I don't want to cover the markings on it. I want to be able to see how much medication is still in here as I push it, so I'm going to flag it with a label. Now I need 2 flushes of normal saline, one for before the medication and one for after. Many facilities have pre-filled syringes of normal saline flush, like I have here, and it has printed right on the syringe that it's 0.9% sodium chloride injection for flush, so I don't need to label this. If, however, my facility didn't have pre-filled syringes, I would need to fill them myself with normal saline, and I would have to make sure and put a label on the syringe before I leave the medroom. You don't ever want to leave the medroom with a syringe with fluid in it without some kind of label on it telling what it is. So even pre-filled syringes come with air in them, so I want to make sure and get all the air out. Don't want to cause an air embolism. Got a little air in there. Now when I'm doing my flush with a central line, I have to use a 10 ml or larger syringe because a smaller one would put more pressure on the lumen and could rupture it. For the medication, I'm going to be pushing it slowly, and so you don't have that danger, and I'll use a syringe that's an appropriate size for the medication that I'm drawing up, which in this case was a 3 ml syringe. So I have my flushes, I have my labeled syringe, I want to take my vial with me, and I want to take my MAR. And I am ready to go, and some alcohol swabs. Hello, I'm Sue. I'm your nurse, and I brought your Lasix that I will put in your IV here. But first, can you tell me your name and your birthday? John Brown, December 2nd, 1960, and that matches the armband and the order. Do you have any allergies, John? No, and I don't see an armband. So I'm going to check my 5 rights. I have the right patient, John Brown. The right drug is Lasix. The right dose is 20 milligrams. The right route is IV push. The right time is now. Don't know if I said the dose, but the right dose is 20 milligrams. Okay. I want to check my site, and I don't see any redness. I don't see any swelling. I don't see any discharge. The dressing is dry and intact. John, is this causing you any pain, or is there any tenderness? No? Okay, I'm ready to go. Now, John has an IV that is infusing into one of his ports, and I don't need to do anything with that. That can continue running. But any ports that are not being used need to be flushed with saline to keep them patent. And for this demonstration, I'm going to be flushing the distal port. So I'm going to take my first alcohol swab, open the clamp on the distal port, and start scrubbing the hub for 15 seconds using my watch, top and also the threads on the side, and clean it vigorously. Then I need to let the hub dry for a minimum of 10 seconds. It may take longer, but it needs to dry for full antiseptic effect. And yes, this does take a bit of time. However, it's very important for full antiseptic effect and to prevent a bloodstream infection. So you do need to take the time for the well-being of your patient. Okay, it's dry. So my first flush, I'm going to just push a little bit in, a couple of tenths, a couple of milliliters, and then I'm going to pull back and aspirate to check for placement. And I want to see good red whole blood in the cannula so that I know I'm in place. Then I can do my vigorous push pause to remove any fibrin that might be building up in the lumen and any residue. Okay, how's that feel? Still looks good. So I'll take my second alcohol swab and clean the hub a second time for 15 seconds using my watch. And then let that air dry for a minimum of 10 seconds or till it's dry. I don't want to fan it, I don't want to blow in it, I just need to let it dry naturally. Okay, it's ready to go. So now I need to push this in over the 1 minute that the book tells me I need to push it in over. And I want to watch my patient, keep an eye on the site while I'm pushing it, and use your watch. For the purposes of this video, I'm not going to push it in over a whole minute, but that's absolutely what I would need to do. And then scrub my hub another time with a new alcohol swab for 15 seconds using friction. And then let it dry for a minimum of 10 seconds. Make sure you have no air in your syringe. And for this second flush, I still have Lasix in the lumen, and it's quite a long lumen inside the patient. So I need to push the flush in over the same rate that the medication went in. So this needs to push in gently over 1 minute. And again, for the purpose of this video, I'm not going to push it in over a minute, but that's what I would need to do. Make sure and reclamp your port. Take a look at your site. Looks the same. How are you doing? Any tenderness? No? Okay. And wash my hands or hand gel them before I leave the room.